Just how many Indians died from COVID in the 2 years of the pandemic? We may never exactly know the answer to that question, but now India does not want the World Health Organization to reveal its findings either. Why? That's the question we're going to ask on the program today. I'm Barkha Dutt, you're with the Mojo Story, and this is our big focus. In the last few weeks, we have seen two different media reports, the first in Devex and then subsequently in the New York Times, saying that the government has contested the World Health Organization's methodology in assessing how many Indians died from the pandemic. As you will know from the ground reporting, extensive ground reporting on this channel, we too have shown in report after report that many more people, and estimates suggest a minimum level of 4 times as many as the official numbers, have died from COVID than is officially acknowledged. So, why is India trying to stop the World Health Organization from publishing its report, which is not in fact India specific, but a global report that is likely to argue that 6 million more people may have died globally than is in fact known? To analyze and decode this controversy that has pitted the government of India against the World Health Organization, let's introduce our panel of experts today. We're joined by Professor Gautam Menon, who's an epidemiologist at the Ashoka University. Welcome, Gautam, to the program. I'm also very pleased to welcome Amruta Byatnal, who is the journalist who first broke this story. The New York Times lapped up the controversy and the attention, but Amruta broke it a couple of weeks earlier. So congratulations on that great scoop. And we'll hear more from you on what your sources are telling you. Dr. Gilada, a doctor at the front lines of COVID, but also a man who understands data. So he's going to look at what the data tells us so far. Dr. Rajeev Jayadevan from Kerala with the Indian Medical Association is with us. And we're also joined by Professor Ramanan Lakshminarayan of Princeton University, among the epidemiologists who has done an extensive data crunching to show that what we know to be our official death count is very, very far from what actually happened on the ground. Something that I can anecdotally reinforce from my travels through the heartland of India, and we can talk about that as the program carries on. Amrita, let's bring you in. As a journalist who broke the story, what did you pick up? What did you pick up is the basis. We have a detailed statement from the Health Ministry now contesting the WHO's methodology. But when you wrote the story, that statement was not on record. And what you were picking up was that the government, in fact, wanted this report to be in abeyance for 10 years. Talk a little bit about what you found.
Yeah, Barkha. So when I was reporting the story, I spoke to a lot of experts who are associated with the story, both within the WHO and independent experts, as you can read in the piece. And the sense that I got was, obviously this is a global study. This is not India specific. So it's not like the WHO has a vendetta, that the WHO is going, against the Indian government. But the sense that I got was that the Indian government was sort of adamant on not publishing this data. They really wanted to hold it back. They, held several meetings, which we now know they're out in the open. There were several meetings with the WHO where they contested the methodology, they contested the way in which the data was gathered. But the sense that I also got from my sources was that India wasn't, willing to share the data that they did actually have. So, on one hand, they're not sharing the data that they have. On the other hand, they're contesting the evidence that is out there, which I think we've seen with earlier COVID-19 mortality estimate studies as well. So in some way, it's not really surprising.
Yeah. And what is the logic in saying don't publish this for 10 years, Amrita?
So the sense, again, because the Indian government didn't respond to me and they haven't really talked about it in their response that was published yesterday either, the sense that I got was that they were saying, let the pandemic be over. We can talk about it later. We're dealing with it now. Our vaccination numbers are great. We've been sort of successful in, responding to the crisis. Why talk about deaths right now? But as you can imagine, and we have experts on this panel who know exactly why talking about deaths is important and talking about the true impact of the pandemic is important. So the WHO is obviously going to go ahead with publishing this data that they have.
Yeah. Ramanan, if I can bring you in, you've done the numbers. As somebody who was on the ground for the last 2 years, I found a number of factors for the undercounting, and I'll just summarize them briefly here, and then you can speak to the numbers. The first simply was that we had bodies being abandoned. We had bodies being abandoned along the banks of the Ganga. I have personally reported from at least six sort of shallow mass graves where the very poor, and we have these pictures that we documented at length taking a boat along the Ganga, simply either pushed bodies into the water or left them there, partly because of poverty, partly because of stigma. Then we had the invisibilization of COVID in rural India. People who did not get a COVID test were not counted among the COVID dead, even though they died often from spikes and fevers very swiftly in their homes in the villages. That was the second reason. The third reason was that many people simply died on the streets, in the ambulance, outside shut doors of hospitals that did not have beds for them. Then there were other affiliated deaths, oxygen shortages, and so on, that were not counted among the COVID deaths. And in this way, I could go on, which is why epidemiologists like yourself decided to look at what's called excess mortality. That is all cause mortality, to try and extrapolate it with what was being declared as the COVID dead. Go ahead. How do you see this controversy? And your own survey suggested a dramatic gap. Your own research suggests a dramatic gap between the official death toll and the actual death toll. Ramanan.
Thanks, Barkha. So let me break this out into a couple of issues. First is to say that counting of deaths in India has always been controversial. I remember a situation 15 years ago, a different government, when the official figures on malaria deaths were 2,000, and the actual number of deaths that we had estimated in the Lancet was 80 to 120,000. There was the same kind of mudslinging. They slandered it. Finally, India increases malaria death count to 48,000. So this is a persistent problem with our system, that it just sort of feels like it has to underplay deaths for a political purpose, which doesn't make sense, because we owe people the truth. And as scientists, this is not a political issue. It's just a straightforward question of crunching the numbers. Now, the estimates of numbers which you're putting up there on the screen right now don't come from one study. They come from different studies with different methodologies. I'll start first with the estimates, say, from Prabhat Jha, which are based on household surveys, randomized household surveys from consumer surveys, to look at who might have known someone with a COVID death and households with a COVID death. So that came, above, about more than 3 million. There was the study from the Institute for Health Metrics and Evaluation at the University of Washington, which again gets to a range anywhere about 3.5 to about 5 million people. We have the Banerjee estimates, which are also somewhere in that range. We have a daily excess death toll number, which is put out by Economist magazine, which is also in the same range. Then we did a study based on civil registration and very careful assessment in just Tamil Nadu. And again, extrapolating the whole country would have meant an undercount about 5 to 6. So overall, there are different groups which are arriving at almost the same conclusion, that India likely had somewhere between 3.5 to about 5.5 million deaths. And so this is not one number, this is not WHO's number. This is by different groups and from different places, and that's where it comes out. I forgot to mention, of course, the Arvind Subramaniam study out of Center for Global Development, again, about 3.5 to 5 million
Yeah.
COVID deaths. Now, all of these are based on different methodologies, but they're consistent. As you pointed out, there were many reasons for deaths not being counted properly in India, which is we don't have a good civil registration system. Therefore, we don't actually have cause of death in most places in India. Number two, if you did not actually die with a COVID certificate, and many people do not have access to a COVID death certificate, you actually did not get counted as a COVID death. So we're doing this study right now out of Tamil Nadu, where we're finding that people with heart attacks and of respiratory disorders were the ones who didn't get counted as COVID deaths most frequently, because it just didn't seem like a COVID death. The person keels over and dies. They had a heart attack, and therefore it just didn't go in. But
And
at the same time, yeah.
no, I was
Uh,
just going to say that all the people who died from oxygen shortages in hospitals were actually given release papers, Ramanan, saying that they died from a cardiac arrest.
Exactly. So if you did not have the test, you didn't have this. And I think at the local level, there was a significant amount of pressure on local officials to really keep the numbers down because their neck was on the line. So it isn't as if there was one single sort of conspiracy to keep the numbers down. We just have a system which doesn't work very, very well for civil registration, and different countries have performed unevenly on this, and India is no exception to what has happened with
Yeah.
COVID.
Dr. Gilada, I'll share another little detail with all of you that in some states, actually, the local officials were instructed that the death certificate should not write the cause of death. In Madhya Pradesh, for example, this happened because, of course, it also got linked to compensation for the very poor who had sold little pieces of jewelry, who had pawned phones. There was some hope that maybe there would be some monetary compensation, but maybe for that reason or for reasons that are not comprehensible, the instructions were very clearly to not give cause of death, and getting a death certificate during pandemic times became a kind of second struggle for literally thousands of poor people that I met across the country. Yet, Dr. Gilada, you're a data's man and you do not agree with the methodology being deployed by the WHO. Why is that?
You see, WHO is an intergovernmental organization, and currently in the whole pandemic, their words were not gospel truth. They were not sacrosanct. It's not on one issue, but on lot of issues they faltered. Till today, they have committees after committees to look at the origin of the Wuhan virus. They have not come out with truth. And in the same breath, they said that in Wuhan there were 5,000 deaths, and maybe they are 50% more. So for Wuhan, they are counting 50% more. Secondly, if you look, you can look at the data. You can see that in the world there are 500 million cases, out of which India had 43, US had 82. These are 9% of the total cases in the. I'm talking about reported cases. Similarly, in deaths, 6.2 million deaths globally, out of which US has 1 million and India had half a million. And when you are extrapolating, what you are extrapolating is what they are saying, that out of 10 deaths in Africa, 9 are unreported. Out of 10 deaths globally, 6 are unreported. But in India, out of 8 deaths, 7 are not reported. So that means you are putting India at par with Africa. You just want to equate with America because the ratio of COVID cases or COVID deaths in America and India is 1:8. So America is 1/4 of India in population, but double the deaths in record on record. So ratio comes 1:8. So if you extrapolate India to by 8, into multiply by 8, it comes to at par with US. Secondly, if you want to extrapolate, you should have some data on some countries which are comparable.
So
Luxembourg.
can I ask you? You don't agree with the WHO template, but do we all agree in principle that a significantly higher number of Indians, Dr. Gilada, have died than what we have officially declared? If we can agree on the principle, we can then debate the methodology.
Yes, yes. So I cannot go back from my own word. I was on your show and saying that yes, deaths are more than what has been reported, maybe 2 times, 3 times, maybe up to 4 times, but not suddenly up to 8 times. And because in India, barring that 2 months of second wave, India has fairly managed well all medical system, and we did not see a surge in deaths afterwards. Currently, with Omicron, our death rate is or case fatality rate is around 0.2%, which was 1.3% cumulatively. So there are no deaths happening or not many deaths happening after that. During that period, not in India, all over the world, it has happened. And
Yeah.
most places they were underreporting.
So,
So
so, so,
we
so
believe in one thing, that yes, there is underreporting. Cases have gone unreported. There could be escalation, and we have all-cause mortality certificates are not given in the country, so we will not come to know. But there is one parameter which can be considered: is compensation is given based on the COVID death, and in that situation, they have taken a lot of parameters, neighbors
yeah.
version, etc., and that numbers are quite
But
significantly
but
higher
but,
than
but
the
here,
number of deaths.
fair enough. But here's my question. We've had multiple global reports come out. Why are we resisting, in particular, this report? Is it, Gautam, because the WHO, for all its faults and flaws, some of which Dr. Gilada listed, would then be considered an official word on the Indian pandemic, as opposed to many of the university centers of the kind that you or Ramanan are associated with?
I think that's partly the case. Mortality is always a very touchy subject, and if you have an official number, a number with some official sanction from the WHO that indicates something like a factor of 8 between the Indian numbers, and that certainly reflects badly on the Indian government and some way of looking at it. On the other hand, you could say that, look, if you want to be truthful about the effects of the pandemic, and this is certainly the most significant public health event that the world has seen, it's not just us. And so we need to come to a certain reckoning about this. We need to understand the people who've lost dear ones, to not count them, to say in some sense that they're irrelevant to the counting is incorrect. I mean, you can argue about the methodology, but to prevent a number being published, I think is probably incorrect.
Well, how do you see the methodology? You heard Dr. Gilada's misgivings, Gautam. What do you think?
I mean, you can argue it in the following way, that you have an estimate of the number of people who are infected before vaccines began to become significant. And that number is probably something like 800 million, 800 to 900 million. From there, you can extrapolate based on what is known about the infection fatality ratio, which for India is probably somewhere between 0.3% and 0.5%, maybe 0.35% or more. If you do that, you get numbers that are closer to the 3 million number than there are to the sort of 500,000 odd that you have for the Indian. So that's one way of doing it that's reasonably objective. Of course, the way that they do it has many other components to it. You have to account for the saving of lives because there were fewer road accidents during that period. You have to account for the loss of lives because people who had needed long-term care, such as diabetes patients, were not able to access that, or people who were on dialysis, etc., were not able to access that. So in a sense, I would trust the ability of the group that came in to make these estimates to do a reasonable job. I'd like to see what these estimates were, what they assumed, and I'd like to see what the objections were to these. Some of the objections that are listed in the PIB document that was shown are, some of them don't really make much sense overall. But I would like to see this back and forth, and I'd like to see the report published, and I'd like to see a response from that, a formal response from the Indian government regarding that, so that we can be clearer about these issues.
Okay, let me bring in Rajeev, and then I'll go back to Ramanan on some of the points that have been raised about the methodology. Rajeev, I know you have some misgivings as well about the methodology, but I think it's much more important to agree first on the larger principle. Go ahead, Dr. Rajeev Jayadevan.
Yes, in medical college, when you do your MBBS, there is a large signboard outside the pathology lab. It says, "Here is where the dead teach the living." Yes, much of the information we know about medicine and health comes from the study of death. So death is a sterile entity. I know it's tragic when we look at it literally, but from the medical standpoint, it's a sterile and a very, let's say, a neutral entity that we look at in order to make less people die, if you will. So accurate data is so important, as Dr. Lakshminarayan mentioned. Data, whether it is on malaria, whether it's on tuberculosis, whether it's on COVID-19, yes, accurate data is no doubt about it. The second point is, for our viewers, I think there's been a lot of jargon mentioned here. I'll just simplify it a little bit for our viewers in 1 minute. COVID deaths that are reported in any country, you can check Google and it'll show you the number of deaths. Now, that is the officially reported number. The unofficial COVID count is what is estimated through what is called the excess mortality rate. That is, I'll give you an example. Kerala, on average, 684 people die in any given day in Kerala over the last several years. That's the average death rate per day, because babies are born, people die. So that's a normal death rate, expected death rate. After COVID, by how many numbers has this number gone up is the question. That is called an excess death rate. So if the death rate went up from 684 to, say, 2000, then we know that there's a large number of unexplained deaths, which can be attributed to COVID-19. So this is for our viewers, so that they're also tuned into this jargon. Now, I'll come to COVID-19 and death reporting. I think Dr. Gilada mentioned a little bit about that, and Dr. Lakshminarayan also mentioned the difficulty. The problem with death reporting is manifold. It comes at many levels. The numbers you see on your phone screen are not the true numbers for many reasons. For one thing, how many people are properly diagnosed with COVID-19 in different parts of the world? The COVID-19 is not a regional or a countrywide matter. It's a global matter.
I know, but that is exactly why I must jump in there to ask you. This WHO report is going to be about the world. It isn't just going to be about India.
Right.
So unless we can empirically counter it, why are we defensive? Why are we defensive? Everybody understands that this was a pandemic. No one is suggesting the government has deliberately chosen not to count the dead. They were a conflation of circumstances. that has led to a certain degree of invisibilization of the poor, a certain poor record keeping, and many other factors that have been listed. Why should we be defensive?
Yeah, the question is, the estimates that are projected, are they real? Is the question, which is not my area of expertise. Counting of deaths and estimating deaths is not my area of expertise, but I can tell you the technical difficulties in estimating deaths. So somebody has to sit and find out across the countries. Every country has undercounting rate. Every country, even the most developed nation, will have undercounting rate for the reasons I mentioned. The question is the undercounting worse in some countries than the others? There will be variation. Even within a country, there will be different undercounting ratios between states. So we discussed that, I think, last year on this program. So the question is the difference of opinion coming from an overestimate? Is that a concern? I do not know. I think I'll have to ask experts like Dr. Lakshmi Narayan for that.
Let me take this to Dr. Lakshmi Narayan. In fact, you heard what Dr. Gilada said, and the health ministry has argued something similar, that basically 18 states, this data has been based on 18 states, that India is a diverse country, it's a very large country, that small and large countries have been clubbed together. Let's pick up your own research in Tamil Nadu. And try and understand, did you extrapolate from that to the rest of the country? Were there patterns that you thought applied, or is there a reality that changes state to state? Dr. Ramanan.
So we did not extrapolate to the entire country from Chennai precisely for the reason that it does not apply. But in Chennai, as you have up on the screen, there were 5.2 excess deaths per thousand residents. But very importantly, during the second wave, for every person who would have normally died in Chennai during that period, there was a 5x, 4 to 5x increase in mortality during that period. Now, in comparison, in Paris, in Italy, the increase in excess mortality during COVID waves was not 400%. It was more like 60% or 70%. So what we observed very clearly from very good data, Tamil Nadu has excellent death reporting data. You can't fudge it. It's actually real. So it was very clear that something unusual happened during the first and the second wave. We also saw, for instance, that the poor were protected during the lockdown. There were fewer poor people dying during the lockdown because of not dying of road traffic accidents and homicides and so forth. In fact, however, during the second wave, the poor were more affected than the rich, which is again something that people are not really familiar with. So we didn't do that extrapolation. But again, the only thing I'd say to Dr. Gilada is this is not one estimate, doesn't come just from an excess death study. Prabhat Jha's numbers are not based on excess deaths. They're actually based on household surveys of people actually knowing if someone had died. Banaji's estimates are based on a mathematical model of counting and modeling the infections. And Barkha, you remember, the interview that you did with me back in March of 2020, and I had projected 2 million deaths, over the next 6-month period, because that was what one would expect for a country the size of India. And so
those numbers, when you had forecast them, became extremely contentious. Both you and I had to receive a lot of sort of questions around those numbers. When you look back at that projection, what do you think? Because that projection was not evident in the first wave at all. And these are numbers we're now talking about at the end of both waves, at the end of 2 years. So when you look back at that projection, how do you see that projection now?
So if you recall, Barkha, we did that interview, I believe on March 17th or 18th of 2020, before there was a national lockdown. And in fact, what I had said was, if there is no serious response to COVID, this is what will happen. Now, the lockdown changed that trajectory entirely, and that's the response we wanted. We needed a lockdown to flatten the curve, and that first lockdown did achieve the flattening of the curve. Many people then said, 6 months later, you didn't have 2 million deaths. I said, yes, it's like the doctor says you have high blood pressure, you should do something about it, otherwise you'll die. And then you actually start exercising and you don't die. So that's a good thing. Similarly, the country took the appropriate measure during the first wave, and that's why we didn't see the deaths. But we didn't take the appropriate measures during the second wave, and that's why we saw the full lethality of the virus. So I don't think in orders of magnitude, the numbers of deaths we saw in India were extraordinary or unusual. It is what one would have expected for a country of India's level of health system preparedness and so forth. So I think, as other panelists have said, I think we need to, as as a country that has done very well on vaccination, as a country that has done over time, not at that time, not in March, but over time very well on testing,
Yeah.
just be straight with the numbers and say, listen, this is what it is. This is like suffering a heart attack. I mean, this came from the outside. This virus didn't originate in India.
Yeah.
So
Let me,
it was
yeah.
done to us in a sense. And therefore, I don't think there is any shame in what happened. And I think we can learn from it.
Gautam, let me ask you to add to that before I come to Amruta and Dr. Gilada. Go ahead, Gautam.
No, I agree with that. I think there's no shame in any of this. That this is every country around the world has suffered. Every country has undercounted in some way or the other. And it should be a challenge to us now to make our counting systems and our data systems better. That's really where we really ought to be going. But there is no shame in having a number that's large. We started off, our country is very heterogeneous. There are many states that have relatively low levels of health systems preparedness. Some other states did better. You expect this patchwork. But that's no reason not to do a good and careful job on this, to challenge it if necessary, to do it scientifically, but not to prevent it from being made public.
Amrita, let me get you there before I give Dr. Gilada the last word on this. When you were writing this story or breaking this story, you were in touch with a lot of members of the WHO Technical Advisory Group. Prabhat Shah, who's actually done the study on excess deaths, is one such member. I'm not asking you to out your sources. I'm just asking you to talk a little bit about what you picked up from the government. Was it denialism? We have our own ways of computing this? Is this a genuine scientific disagreement, or is this a political disagreement?
Again, I mean, I spoke with Dr. Jha, I spoke with other members of the tag, and other people who are also associated with the study, who are not within the WHO. And the sense that I got was that it is a political issue, and the government just does not want to go there right now. They don't want to talk about, the sort of extent of mortality that we have seen. I've also heard from other researchers that their studies have been blocked due to pressure from the Indian government. And these are studies that were funded by big funders, like big multilateral banks. And the funders put pressure on these scientists to, not release their studies. So WHO is not the only organization. I feel like we will know in the future the extent of studies that have been blocked. And I think that the Indian government was successful in blocking it before and silencing these scientists. And maybe they thought they would do it with the WHO as well. But this is a global study. And, as Dr. Samira Asma from the WHO points out, this is not to say that a country is bad. And, this is not a naming and shaming game. It's more of a learning process to sort of put systems in place before the next pandemic hits us.
Dr. Gilada, just if you would like to come back to the fact that you believe the study clubs India and Africa, please go ahead with your misgivings, and maybe I'll get Dr. Ramanan to get in a quick last response to them. Go ahead, Dr. Gilada.
Barkha, basically, if you are extrapolating from 6.2 million to 50 million for the globe, and then you are extrapolating 0.5 million to 4 million for India, that is something which is atrocious. Second thing, in all hospitals, in all states, they have a system called death audit. And death audit is done with experts, and then they correct the deaths also. So actually, Government of India should have done that, death auditing. They have done a partial job of which is administrative death audit for only compensation purpose. But medical death audit has not been done. And governments all over the world, including Government of India, they are always in 4 stages of denial to despair. Denial, blaming others, recognition of the problem, and going despair. So that denial, I don't deny that there is a denial. But at the same time, if you come with a realistic figure, if you come and explain to them how it could have happened, if your numbers were so many for cases, what happens is when number of infections are there, they can be extrapolated to 10 times more, because out of 10, one is tested and detected. But if you cannot extrapolate death to 10 times, because every sick person or every dying person would go to a hospital. So your infection mortality rate will be different than the case fatality.
Actually, a lot of people. Just one disagreement. A lot of people I met in rural India did not go to hospitals. They either did not know how to reach
that's the
hospitals
reason we need
in
audit.
the lockdown. Yes,
that's the reason we need audit, both administrative audit and medical audit. And
okay.
You can come to a conclusion that after 2 audits, we have come to this conclusion. Figure will be definitely much higher than 0.5 million, but it will be lower than 4 million, what I believe.
Raman, a quick response to that.
In our country, 20% at best of deaths are medically certified. So unfortunately, I wish that what Dr. Gilada was saying were true, that there is a system for death audit, but people die in homes, they're buried or cremated right next to their homes. There is nobody in the system that even knows that that person has died, let alone what they died of. So we typically correct these numbers at the time of the census, which is when we have an idea of the demography, and certainly acute events, particularly when you have so many people dying in such a short period of time, like happened during COVID, which we have never experienced in our lifetimes, which have not experienced in probably 100 years. These are extraordinary events, and the systems don't exist to really take care of it. So, which is why, if you can't keep going back to but you have to convince me, these papers are published in Science, they publish in the Lancet. These are the leading journals of the world that are respected by all scientists and people who these are peer reviewed extensively. That Science paper would have had 8 reviewers all trying to figure out what's wrong with it. And when you understand the process through which these papers get published, you realize that peer review process has already done the checks and balances. And that's how, as scientists, we know how to work. We don't know how to work in any other way. And
well, I would just say in conclusion that rather than rather than refuting behind the scenes the World Health Organization, the government should come out and have a spirited lead. In fact, steer a spirited public debate. Let the best epidemiologists, let the reporters who were on the ground come forth with eyewitness testimonies. Let all of you, as you are disagreeing on this program, be part of a public debate. Because as they say, one of the things we try to do is to say that people should not die a mere statistic. But here we are saying that people may not even die a statistic. And that is something that would be truly tragic. We'll have to leave it there. Thanking our panel of experts. I'm sure there'll be a lot more to unpack when the World Health Organization does publish that report. And we'll have all of you back then. Thank you very much, and see you soon. Goodbye. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.